The goal of our study was to examine the diagnostic and demographic characteristics of the current pediatric population receiving antipsychotics in the United States. Our main findings suggested that although children with psychotic disorders had the highest likelihood of antipsychotic initiation, these disorders occurred in only 12 and 8% of antipsychotic recipients. On the other hand, depressive disorders and ADHD occurred in 46% and 43% of recipients, respectively. Examination of racial and ethnic characteristics of children receiving antipsychotics suggested that groups from minority backgrounds had lower rates and odds of antipsychotic initiation compared to white youth. This was especially evident for Asian children, who had 60% lower odds of receiving antipsychotics compared to white children. These results were obtained through the Clin4matics Datamart dataset, which is a large commercial health claims dataset. In our analyses, we first created a case group of antipsychotic initiators and a second control group who did not initiate antipsychotic use from patients between the ages of 6 to 17 years old. We then calculated the odds of being a new antipsychotic initiator based on race or ethnicity and mental health diagnosis. Finally, we reported the racial and ethnic distributions and mental health conditions occurring among antipsychotic users and matched controls. Importantly, our findings suggest that most initiators who take antipsychotics have conditions such as ADHD and depressive disorders, which have rarely been studied in clinical trials or observational studies, and therefore should inspire further research on these conditions. Furthermore, although our study was not equipped to identify causal mechanisms related to initiation among Asian youth, this does reflect a need for further research on demographic differences related to psychotropic use. Finally, these results highlight the importance of studying how antipsychotics may influence prognosis for conditions occurring in all children who take these medications.